Hello everybody here in Brazil and Switzerland. Olá todo mundo aqui no nosso Instagram, aqui no nosso Facebook, aqui no nosso TikTok. Boa tarde do Brasil, boa noite da Suíça. Sou o Dr. Múcio Porto, cirurgião plástico aqui em Brasília e em Dubai. E hoje ao som de Madonna, Beat Goes On. Quer dizer, as coisas continuam? A gente vai ter uma live bem interessante com a doutora Sylvana Ingold. Claro que é em inglês que a gente vai falar. Jéssica Maia, bem-vinda. João da Xavier, Gisele, todo mundo. Muito bem, então hoje a gente vai falar sobre o que está batendo por aí no mercado, ao som da Madonna, claro que só no início, que são os bioestimuladores ou bioredermalizadores ou biorevitalizadores, essa onda de coisas legais. Dr. Laskowska from Poland, this is an honor for me to have you here. Então, para todo mundo aqui no Brasil, claro, se quiserem fazer perguntas, a gente vai fazer, claro, uma tradução. Mas a gente vai, obviamente, falar inglês com a doutora Sylvana. Sylvana from... yes, Dr. Ingold, Dr. Sylvana. I will put you inside. Yes, you're welcome with Madonna. What's going on? What's going on? What's going on? Ingold here in Instagram. Okay. Where are you now? Hello, she's coming. Hello, dear. How are
Greetings from
you?
Switzerland.
Be welcome in Brazil.
How are you?
I'm fine, especially because I'm talking to you, listening Madonna, and this is so happy. But of course, I will remove Madonna right now. Come on, Madonna. Oh yes, stop it. Yeah, be
Perfect.
welcome, my friend.
How are you? How is the weather there in Brazil?
The weather is fine. Of course, this is winter. No, is this winter time? No, this is autumn. Autumn. But
Wow.
this is a little bit cold. It's around 11 degrees Celsius or
Oh,
10 degrees. It's not the Swiss winter, of course, but it's especially at night. It's pretty cold for us. And you know,
I
Brazilians,
see.
when the temperature falls more than 10 degrees Celsius, we are freezing. Dr. Rashad Haddad from Dubai, from Paris, my dear
I
friend,
can
it's an honor for
understand.
me to have you here. Wow, yes. Ana Coelho, be welcome. Parvin Sultana, be welcome. Amir Kamel Official, it's a pleasure, my friend. Be welcome. Yes, today, let me introduce you everything. I am Dr. Mushu Porto. I'm a plastic surgeon here in Brazil and Dubai. And my good friend, Dr. Sylvana Ingold, she's a aesthetic surgeon in Switzerland, but of course in the whole world. She's my colleague at the American Academy of Aesthetic Medicine. Dr. Rashad, I'm so
The
happy to
pleasure,
listen
the
in you. I
pleasure
hope
is
to see you
ours.
again. Yeah, it's a big friend of mine, the best gynecologist in Dubai and the whole world. It's a pleasure for me to have you here. And yes, Dr. Sylvana, she's a static surgeon in Switzerland. We give lectures around the globe for the American Academy. And Dr. Sylvana suggested me to talk about a brand new thing. It's not very brand new, but it's a new thing. VP Odontologia Integrada, be welcome, my friend. Thank you so much. And yes, biostimulants or biostimulators and another new concepts going on in the whole world, talking about collagen stimulation. And this is the topic for our live broadcast today. And yes, Dr. Sylvana, she is an authority on this field. And of course, we will share some experiences and comparisons, maybe Brazil and Latin America and Europe, especially Switzerland. And I think it's a very interesting thing. Of course, this live broadcast will be dropped on our Instagram pages, our website. This is www.mucioporto.com.br. You can check it out later. And also here in Facebook and then in TikTok also. And yes, this is a time for you doctors or patients or intelligent people to improve your knowledge for helping you to decide about what kind of things are those. And we will begin with my dear friend, Dr. Sylvana, talking to us about exactly what is this concept now. Tell me, Dr. Sylvana, what
Thank you.
exactly? Because people are angry, eager for this, um, let's say, option, isn't it? Tell me
First of
about that.
all,
What does it mean, biostimulants?
First of all, I would like to deeply thank you for because it's a big pleasure and honor for me to share this live with a legendary personality like you today, and we're going to share our experience based on our clinical practice with colleagues and with patients among the globe.
Good.
uh, Biostimulators or biostimulants, but the correct terminology in the field of aesthetic medicine and aesthetic plastic surgery is biostimulators, are really are a big trend and are very in nowadays. But what are the biostimulators? The biostimulators are injectable substances that once we inject these substances in our skin, in our tissue, they are able to induce the production of our own collagen and elastin. So they are not like the traditional base hyaluronic acid fillers, which replace the loss of volume, but they offer us something more. And what is this more? Is more collagen and more elastin. So we love it, right? We want more own collagen and elastin.
And this is a very good thing for you to mention because I think this is a mistake of us doctors because every single day we are always talking about collagen, collagen, collagen stimulation. But when we talk about biostimulants or biostimulators, we are talking about more than just collagen. And
Exactly.
especially when we are talking about rejuvenation, a good skin quality, the word elastin is also magic, isn't it, Doc? And a very good thing because you mentioned not only collagen, but also elastin and other things like hyaluronic acid. So, by the way, Sylvana, Madame Hula Younes, c'est un plaisir de voir ici. Hein? C'est mon ami. Mrs. Ruhula, she was a former Brazilian ambassador in Ukraine, a
Oh,
friend of mine. This is a very an honor for me to have you here. Aline Tavares, Marcia Hello, Lizzie Silvia Estrada, welcome all of you here in Instagram. Dr. Zulfi Minhas here in Facebook from London. How are you, my friend? Dr. Silvana, Dr. Zulfi was a delegate in Budapest 2 years ago, and a big friend of mine, a wonderful doctor in London. And oh God, I'm full of good souls all around. But
what
yes,
a pleasure.
Sylvana, tell me, yes, we are talking about first, of course, by the way, we will do a concise live
Exactly.
broadcast around 25, 30 minutes because I know you have a lot of things to talk. And but we will be concise because although this is Sunday, isn't it? Oh, Dr. Carla Obis, my dermatologist in my clinic in Brasilia. Be welcome, my friend. And so, Silvana, I'm so sorry to interrupt you, but
No, no, no.
you
It's
know,
a pleasure
isn't it?
to
So,
welcome all the
Silvana, tell me,
colleagues.
you told us the real concept of biostimulants. Oh my goodness, Dr. Sherish Fayaz from Iran. I hope you are fine, my friends, with such a problem now. God bless you all. This is an honor for me to have you here too. And yes, so you talk about biostimulants as a, let's say, a weapon we have today. This is a big concept, a lot of examples. I would like you to talk, but you told us that this is for stimulation of collagen fibers and elastic fibers, and but I would like you to talk how. Does it work?
Yes. First of all, Mijo, I suggest before we go to the next step, how does it work, to tell to our audience which are the most common biostimulators that we know nowadays. Just a summary,
Fantastic.
and I would like also to hear which are the most famous biostimulators in Brazil also. Here in Switzerland and in Europe, we have biostimulator with PLA. PLL is polylactic acid, and the most famous is the traditional Sculptra, and now we have a new one, the Julane, which is something not only biostimulator but also biorestoration.
Wow.
We have also Elance, which is a biostimulator with PCL. So PCL means polycaprolactone. We have the Radiesse with calcium hydroxyapatite. And we have also the Profilo, the well-known Profilo, which is a hybrid biostimulator with hyaluronic acid. It has a combination with reticulated and non-reticulated hyaluronic acid. Do you have
Fantastic.
something more in
Mm,
Brazil?
Yes, here we have, of course, the same as you told us, like Profile, like Sculptra. It was, by the way, Sculptra, it was on the market in the late 1990s. There was another name, I can't remember, and it was suggested for us to inject on CrossFit.
Oh,
But
really?
oh yeah, and we got some granulomas, and it was a nightmare. So it disappeared. And early 2000s, from Holland, another doctor, I can't remember, described that polylactic acid, PLLA, as you said, should be done deep, and it becomes the star of biostimulant. So yes, Sculptra we have here. And as you told us, Elance, there are another brand here in Brazil of PLLA called Eleva. But Joline, this one you told us we still don't have here in Brazil. And
Okay.
yes, Rafaela Corvallia, which is your favorite biostimulator? Yes, Dr. Silvana. By the way,
Oh,
tell us what is your preferable biostimulants for your practice.
I used to work with Sculptra in for both face and body. So it depends on the case, but among my favorite is it used to be Sculptra, but now I replaced Sculptra with Julane only for the face.
Tell me about Dulane. We still don't have it. I think we have in Dubai, but I didn't use it yet.
Yes,
But tell me
yes.
about Dulane. What do you think? What are your impressions? Dulane is from Sweden, is it?
Yes,
Yeah.
exactly. Is from Sweden, and I personally believe that it will be it will be more in the future a game changer because it is based on polylactic acid, so it means it can stimulate our own cells for a long term to produce collagen and elastin. But
Yes.
in comparison to the party cells of Sculptra, here we have more smooth, the party cells are in a spheric form, which means that the inflammation process caused to our tissue in order to stimulate the production of collagen and elastin is really minime. So we have here not only a stimulation, but also a restoration and a long-term health for our cells. That's why they have an indication to inject the nasolabial folds, the marionette lines, also the periocular area. And I have really, I'm working around 5 months with these products, and I have amazing. I don't work for the firma, I don't have conflict of interest, but it's really an amazing because
Mhm.
you can treat the loss of volume, like the temple area, sagginess of the skin, fine lines. I also saw a relevant improvement in the hyperpigmentation. So for
Yeah.
me, at the moment, I work a lot with Julaine in face, and now I'm going also to start to work also for neck, but for body I use Sculptra.
Oh, yeah. For me, almost the same. I love Sculptra or Eleva. Eleva is a Korean one. Here in Brazil, the brand, excuse me, is Eleva. In Dubai is Ghana. And differently from the Sculptra, we can prepare it now and inject it now. The other way is Coptra. We need to prepare it today, and I need to wait 2 or 3 days. But it's a physical property. The final effect is quite the same. And I'm so sorry. We are also talking about today about on harmonica. Harmonica is an association of calcium hydroxyapatite and caprolactone. No, 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 and hyaluronic
Uh,
acid.
Hyaluronic
And
acid, yes.
yes, and by the way, you told us about radiesse, about calcium hydroxyapatite. What do you think about calcium hydroxyapatite?
I don't work with harmonica. I don't like harmonica.
Hmm.
Sorry. Um, because I prefer Radiesse, and I use Radiesse to young patient around 30, 35, and I use if I want to make a more definition. So for patients who don't have a very saggy skin, the elasticity is still okay. And I prefer there to work with Radiesse. I do, but I would like to point out that I always use only hyper-diluted Radiesse or normal
Okay.
diluted. I never use Radiesse like a filler to increase volume. I use it like a biostimulator,
So it
but I
means that
use,
you dilute it.
yes,
When,
exactly.
because this is a confusion here. Mrs. Johnny in Gold is asking us, when do you use and which biostimulator? And you are introducing it, beginning talking about that. For example, Radiesse, it was formerly as a filler, but then with time we begin diluting with saline, for example, and it's called now biostimulator. So
Exactly.
answering the question, when to use which biostimulator? It's very interesting.
Exactly. I prefer, as I told before, to use Radiesse if I have young patients, if I see that they want a more definition, but at the same time also a biostimulator effect. And I dilute 1.5. I use 1.5 ml Radiesse for the whole face, and I dilute it in 3 ml from normal saline.
So it's the double. You take
Yes,
1.5 cc Radiesse. Radiesse, by the way, is the brand of the product is calcium hydroxyapatite.
hydroxyapatite.
So you take 1.5 and take the double, 3 cc. And
Yes,
you mix, mix,
exactly.
mix, mix, and use. Very
Exactly,
interesting. Yeah.
exactly, yes. And I treat the middle part of the face and also the lower part. It's amazing to make a definition in the lower part of the face to treat the jawline. And sometimes I use it also for the neck. It works
Oh.
amazing. Or also to make a hand rejuvenation. It is my favorite.
By the way, when you say when you use for the neck, there are some interesting differences. Generally, we talk about the submental area and or necklines.
Exactly. I
Which
use
one
it.
you use? You are talking about radiacid diluted, of course.
Yes, exactly. I sometimes it depends if the skin is really very thin, I dilute it more. So I add 1.5 ml normal saline more, and I treat both the submental
So
area.
3 times more. You mean you take
Exactly,
1.5 cc radiesse and 3 times, it means 4.5 cc's. Absolutely
exactly,
diluted, but of course, absolutely useful, isn't it?
exactly. It works fantastic. It works fantastic,
By the
and
way,
I treat.
Sylvana, I'm so sorry to interrupt you, but
No problem.
sometimes I don't know if you see it. But when I talk to my patients that I will dilute, maybe they think that I'm trying to get more money and using less. Isn't it important to make it clear that when we say dilute, it means that this is the purpose?
Exactly,
Yeah,
exactly. Because if we dilute it, we can have the biostimulator process. Because if we
sure.
don't dilute the product, we are going to have more volume, and our purpose is not volume, but is to biostimulate, so to trigger our own cells to produce everything that we need.
So, by the way, for us to keep forward to the next topic, let's finalize. So, in my opinion, in your opinion, maybe PLLA, polylactic acid, and calcium hydroxyapatite are, let's say, uh,
The
maybe not
most
the best, but the most used. Is it?
Exactly,
Good.
exactly. Yes,
Good.
it is true. Yes. I
So,
used to use also Elancey in the past,
oh, me too. Yes.
but
What's
now
your
not
impression of
anymore.
LNC? Because I,
No, because it was not the guidelines were really very, very confused. So I stopped to use it because I had a case with a granuloma in the
oh yeah, me too.
periocular
Me too.
area.
Yeah.
And I didn't inject it this area. I injected only the mid face, and I had a granuloma in very close to the temples, and it was impossible to dissolve this granuloma. And after I made a small incision and I removed it. And
Yeah.
after this complication, I stopped with Elance, and the results were okay, but not wow. And we want to deliver excellent results to our patients. That's why
Yeah.
I stopped to work with it, and now I'm working only with PLL and with calcium hydroxyapatite.
And there's another point, very important here, budget. Of course, our patients, of course, they trust on us and they want to improve their skin and faces, but there's a limit, of course. So we need to find the best one, of course, with nice price, isn't it?
Exactly,
Of course,
and the
we are not
safest.
talking
Yeah.
about very cheap things. We are talking
No,
about good
no.
things, but of
Yes,
course, we need to know that maybe that one is probably better, but it's so expensive. And more than that, we are following science, of course. Here we are not,
exactly,
yeah. And all the papers
exactly,
and articles talking about the comparisons talk about those that we are talking about. Dr. Silvana,
exactly.
we got a question here about pregnancy. Do
Oh
you use
no,
on pregnancy?
no, no, I don't touch
Sure.
pregnant women. Don't
Yeah.
touch pregnant women. Pregnancy is a very beautiful time for every woman. So it doesn't make any sense to do invasive aesthetic procedures during pregnancy. For a lot of reasons. And first of all, we don't have enough scientific data. And on the other side, since pregnancy is it's very beautiful, but at the same time, a very risky time. So if something happens, the doctor after has to show to the patient that it was not due to the injection, and you can demonstrate it if you don't have enough scientific data. So I never touch, and I suggest to each one, don't touch a pregnant woman.
Absolutely. Very quickly, here we have a question about Botox preventively. Well, it's not a topic for our live, but yes, in my opinion, I wait for the early 20s, maybe depending on the skin quality. But anyway, so Dr. Silvana, of course, what about you? Botox
Because
preventively.
so I can tell you, I started once I was 28. So
Ah,
for me, it's not every case is different, but
yeah.
if yes, but around 30, I think it's the ideal age. So I have also a lot of patients, they are 50, 55, and they ask me, oh, it's too early for me to start. And I tell them, no, it's too late, but never it's too late.
We never know how long we will live here, so it's better to stay ready to begin. You know, because
Yes,
beauty, we are talking about self-esteem.
Yes,
And yes,
exactly.
Dr. Silvana, let's go ahead. And what about how do they work? Tell me.
Exactly.
Yeah,
So once we inject the biostimulators in our skin, the biostimulators they stimulate receptors in our own cells. So we have a triggering in our body, and our cells bring there all the cells who are. So I make it very scientific, very simple in order so that each one can understand it, because our audience is not mainly composed from doctors, and our own cells start after to produce collagen first and elastin, and principally collagen type 1.
good.
But at the same time, we have also a strong inflammatory process. That's why we should also inform our patients that swelling after biostimulators can be normal, because sometimes they are afraid that the face is going to be like this. They are afraid about pillow faces, overfill faces. That's why it's our duty to inform them that this swelling is due a temporary inflammatory process and it's going to disappear. But as I told you before, that's why I love Julian, because there the wall inflammation is less than the normal biostimulators with PLL and calcium hydroxyapatite. That's why there I have really less swelling, and patients that don't have to massage after, because with Sculptra, with the traditional PLL or calcium hydroxyapatite patients, they must massage.
Good.
and
So, yes, go ahead.
and that's why in order to have collagen and elastin, it needs at least 4 weeks. So we should also inform our patient, because sometimes they call me after 3-4 days and tell me, oh, okay, but now I don't have a lot of swelling, but I don't see any results. That the results are coming. The results are not immediate like with traditional hyaluronic acid fillers. That's why we see the end results after 2, 3, 4 months. And that's why we suggest also, it depends on the case, to perform 2 or also 3 treatments of biostimulators around 6 weeks apart.
Good. This is another topic, very important, about protocols. So you told us about how many you are talking about Jolene and Sculptra, for example, or not? Just
Yes,
Jolene.
exactly. Exact. I used, if you want, I can make also the comparison. Before, once I used to work with Sculptra for the face. There, I used to do 5 or 6 times every 6 weeks in order to see a good effect. Because remember that our patients, they want to see something. So
Sure.
I always inform them before that we start a journey with a biostimulator for a more tightened, firming skin, and this journey is going to last 6 months, example given. But now with Julaine, I noticed that I have results after 2 months, and until now I never performed more than two treatments, only 2 treatments, and the results are really amazing. That's why I completely replaced Sculptra with Julaine for the face.
Good. And so is it necessary to repeat in 1 year or how long? Because, I always say to my patients that collagen stimulation, rejuvenation, let's say, it never stops. It's not a
Exactly.
disease. You will treat it, and this is okay. What do you
Exactly.
think about that? How long? How many months? Or, of course, patients and patients are different. But what do you
Exactly.
think?
Um, for me, it's important that we inform our patients before we start the treatment. I tell them, because they always ask me, "Oh, how long is going to last?" And if you tell them it's going to last 2 or 2.5 years, they say, "Oh, okay, for 2 or 2.5 years, I'm going to relax." I tell them, "No." because we are losing also collagen and elastin. So because the beauty, the biostimulation is a continuous process. So I suggest them to repeat after 1.5 or 2 years. But during this time, I recommend them advanced skincare for at home or chemical peels or some high energy devices. So it depends on the case, but
Good,
or the normal botulinum toxin treatment. So a holistic approach, more
good.
treatments.
Very nice. And this is the last topic. But before that, I saw a very interesting question here. What do you think about what are the best regions on face for biostimulants?
Very
Isn't it?
intelligent question. Really, wow. So I'm going to tell you what I'm doing now because when I started with the biostimulation, because I use Sculptra more than 10 years, I was very conservative. And in the past, I used to treat only the middle part of the face, the lateral part, and the jawline. But
Good.
now I'm treating with Julaine the temples because with the time we use volume and the concavity in the temples increase. So I use the temples, but really teeny quantities.
Uh-huh.
I I treat the mid face, the lower face, and the nasolabial folds, and also the marionette lines. What I avoid to treat is the perioral area, so the white lip area, and of course the lips, because there is a very high dynamic area, and there I still work with hyaluronic acid.
Oh, me too, the same. And finally, Silvana, because the time is going on, you told us about some devices, and this is very interesting because we are talking about a specific kind of, let's say, options for treatments. But we all, of course, we have other options like machines, devices, botulinum toxins, surgeries, peels, and whatever. But as a final topic for those people to understand, oh, by the way, here we have many people on Facebook. They can't see you, but because we are talking on Instagram. If you want to see the beautiful Dr. Silvana face, let's go to Instagram. But I think you can listen to. Welcome, Mrs. Becky Tortara here on Facebook. Be welcome. So yes,
Next
Silvana.
time we are going. Next time I'm going to go also to we are going to coordinate Facebook and TikTok also. So we are
There's no
going
problem
to
at all.
speak.
Yes, but by the way, all of you, if you want to check out this broadcast, you can go up to our Instagram and websites, whatever. And also, if you, yeah, Dr. Zulfi Minas from London, he's now from in Instagram. Well, anyway, but it will be there. But finally, Silvana, talk to me about your protocols when you want to associate, let's say, machines or devices like HIFU, microneedling, blah blah blah, and biostimulants. What are your thoughts about
Our
that?
approach. Yes, for us in my clinics, each patient, we don't have standard treatment protocols. For us, each patient is unique and he or she has unique needs.
Uh-huh.
So once I see the patient and for the consultation there, it depends. If I see that the quality of the skin is not in very good condition, first I suggest them to use an advanced skincare routine at home for 1 month, and at the same time we work also with chemical peels. So for me, even if I'm a surgeon, for me healthy skin is first of all, and
Good.
after we go deeper. And there if I see that they have a very saggy skin with massive loss of elasticity, after I work with biostimulators, and after 6 to 12 months after I incorporate my Morpheus 8, which is microneedling radiofrequency, or if I have a good volume but the sudginess of the skin persists after I work with Ultraform or 8. If I have a younger patient around 25 or 28, and I see that she wants to improve the quality of the skin, but the elasticity is good and we don't have a lot of volume loss, there I work with chemical peels or with profiler. So each patient is different, but I love the holistic approach, and I never tell my patient, okay, the solution to your problem is are the biostimulators, because it's not true. It's
Yeah.
always about a holistic approach, because if we perform to somebody, to a woman or to a man, biostimulated, but the quality of the skin is not good, they are not going to be happy. And it's our duty to inform our patient, because at the end it's like making the right diagnosis, and only if you can make the right diagnosis, you can offer to them the right therapy, and they are going at the end to be happy. So it's
Yeah,
about
great.
holistic approach, and to combine together more treatments. So it's something that I perform also in my face, because they ask me always, oh, you look so natural, you look so young, and say yes. And my life is not always easy with 3 kids and 2 clinics, but it's everything about a holistic approach. This is my personal opinion, but I'm interested to hear also, what do you think about it?
No, I think it's almost the same. We are both aesthetic surgeons, so we see more and more that people are trying to avoid invasive procedures, and in the other hand, they do invasive. I mean, not invasive in the sense of danger, but specific indication. But also after some surgeries, we need to improve the quality of the tissue. And the thing I say to my patients is that 30 years ago, when I began, the question was, what is the best treatment for rejuvenation? At that time, it was Botox. Some years later, the new question, the same question was, what is the best treatment for rejuvenation now in 2000s? The question was fillers. Yeah. And today, 2025, what is the best treatment for rejuvenation? In my opinion, is depends on your case, because we have a lot of understanding. We know today that sagging of the face is a 3D process, not only face, but also fat and muscles. And we need to
Exactly.
think about association. And we have a lot of
Exactly.
options, and the doctors need to stay tuned. I saw many colleagues here passing by, and I think everybody knows the same. We need to analyze the complaint of the patient and the case we are facing on, and we will decide. But of course, once more, biostimulants today is one of the best or very interesting way for maintaining tightening. This is what I say. More than
Exactly.
just filler, because filler will improve the chin and the cheeks or lips, blah, blah, blah. But we need also things for tightening. And on this sense, what you said about association is absolutely important, because we need to understand that process of 3 dimension, 3D, let's say movement. And that's why different layers need different approaches.
Exactly.
But
Exactly.
as a final message, my dear friend, um, how do you, let's say, describe or put on your practice this option, biostimulant? Is this, let's say, for big? Of course, there are different cases, but how do you understand biostimulant uh, on the beginning of treatment, in the middle, or for maintenance? I would really love to listen to your opinion.
So it depends. For people who are around between 30 and 40s, in the beginning, between 40s and 55 in association with other treatments,
Very
and
interesting.
after, because I have sometimes a lot of patients, they are 60, 65, and they have saggy skin, loss of volume, and there, and they tell me, oh, okay, I don't want surgery. And I tell them, yes, but you have to do surgery. It's not, the solution is surgery, and after we can, because even if we perform a facelifting, and after, we should work with biostimulators, with other treatments. And but starting after 50, 55, 60, I suggest biostimulators as maintenance. And first
Oh,
there, but of course we have also cases who performed a lot of preventive aesthetic medicine. So it's not each person at 60s the same like another one who never had a treatment. But if I, because you asked me to make like a standard, this is my approach. So in the early 40s, before, in the 50s with other, and after as a maintenance.
very good. So the final message is maybe biostimulants are here to stay. Yes.
Exactly. And it's
And
not about miracle, it's
of
about
course
the
not.
combination at the right patient, right time, and the right treatment, the right
Yeah.
biostimulators.
Yes. Well, just begin before we finish,
We
three
have
questions.
yes, please go on with the questions. Exactly,
Yes, one
exactly.
question in the past I saw here. May I associate, for example, some patient, he got, I don't know, Sculptra. Is it safe or intelligent to do another biostimulant? What do you think? Not, of course, maybe at the same time there are some papers talking about, but I'm talking, I think the question is, I did a Lance last year. Now, is it safe for me to use a Sculptra or what you say?
Well, there I suggest, because if we switch to other families of biostimulators, example given Elan says Cultra, so polycaprolactone, polylactic acid, calcium hydroxyapatite, there I suggest to wait around 9 to 12 years, because are different, uh, are
9 to
all
12
are
months.
biostimulators. What?
9 to 12 months, not
Yes,
years.
months.
No, good.
Sorry, months. Yes, yes, yes. I
Another
was
question
forgetting.
here from Dr. Zulfi Minas. Your opinion, what's your experience with Profile? What you
I
think?
I always tell that Profilo is like putting the cherry on the tort, but first we have to build the tort.
Absolutely nice. But for some lines, neck lines, I
It it
love
works
Profile.
it works good, but always you have to. I work there a lot with chemical peels
Ah, good.
before, and with radiesse, and after I use Profilo. But Profilo is, maybe it's my first option only if I have really very young patients, or
Good.
patients who used to do anti-aging treatment, so the skin quality is really in good condition.
Yeah, me too. I think the same. And the final question is biostimulants for hair. What do you think?
Biostimulants for hair. So for hair, I never no. There I have experience. I use exosomes there. It works really very very good.
Good.
But only exosomes. I never put other biostimulants in the scalp.
Me too. There are no interesting papers talking about effectivity, and more than that, biostimulants we need to spread on a layer, and of course on the scalp we have a lot of fibrosis, and maybe the volume could let's say harm a little bit the
Yes.
the hair follicle. My dear
Exactly.
friend, Dr. Silvan, I'm so happy for talking to you. Thank you so much for the idea of talking about biostimulants. And may we have another, may I give you another suggestion, another
Please.
live, because we are talking for the last 45 minutes. I supposed to talk
Oh,
30. Yes, it
oh.
means that this is absolutely interesting for people. What do you think about, we talk about biostimulants and energies, whatever, for body. What do you think?
Yes, wow,
Let's
it
talk
will
about
be
that.
yes, yes, let's
Good.
do it. Yes, it's a very good idea and looking forward to share experience.
Yeah.
And it was fantastic that we received so many questions. It means that our audience is really very interesting. And also as a patient, Musio, is really our patients are really very confused
Yeah.
because they receive a
Even
lot of
doctors, huh?
information.
Even
Yes,
doctors sometimes.
yes, exactly, exactly. Because they receive so many information, and exactly because I was now at BTS Congress in Stockholm, and there also there is for a lot of topics there are not enough data, so it's always important to share knowledge and to discuss
Yeah.
because we want to deliver excellence to our patients and safety. First
Good.
of all,
Absolutely.
safety, and after excellence. Yes.
Good. And the final question here, the very final, are there any precautions and what we should take before and after about biostimulants?
To take. So
Yeah, before and after.
yes. So it's always important before we make biostimulation to our patients to have an accurate anamnesis, so to ask them which treatments they undergone, if they take medications, if they have allergies. And
Yeah.
after biostimulators, it's very important to to avoid to do other treatments the next 2 to 3 months. So they must be patient, they must wait. And there are some colleagues, mainly dermatologists, and they give to the patients for 2 or 3 days cortisone in order to calm down the swelling. Me, no, I never had.
No, it makes no sense. It makes no
Yes,
sense because, as you told us, biostimulants will promote inflammation,
exactly,
a good
exactly,
inflammation. And
exactly,
if you
exactly.
use it,
You
it's
block
like
the
I want
inflammation.
to put fire on my fireplace, but I will use
Exactly.
water.
Exactly, exactly.
Of
That's why not, but because I ask a very good friend of mine a couple
course,
of
there are
days
cases
before.
and cases. Some people, I'm so sorry to interrupt,
No, no.
but for example, you do biostimulant and a huge swelling, maybe yes, but not as a protocol, isn't
Yes,
it?
exactly, exactly. Me no, I put sometimes in my clinic cold pack, but not in minus temperature
Oh
because we
yeah.
don't want around 4 to 6 degrees in order to calm down the swelling. And I inform my patients that you are going to have swelling for the
Yeah,
next
it's
couple
normal.
of days, and it's normal. And I don't combine biostimulators once I treat the upper face area. I don't combine with botulinum toxin. So maybe I perform always first botulinum toxin and after biostimulators.
Oh, very
Yes,
nice, huh? Very nice.
yes,
So generally, final thing. If
yes,
I want to associate biostimulant and a device, my opinion, I do biostimulant first and then high flow, microneedling. What do you think?
exactly, exactly the same.
Yeah.
Exactly the same. Yes, yes,
Wow,
yes.
my dear friend, I'm so honored to have Switzerland
The
invading
honor and the
Brazil
pleasure is
airspace.
on.
It's a pleasure for me.
Was
Oh, by the
for
way,
me.
let's talk to everybody here on November. We will talk on the American Academy of Aesthetic Medicine meeting in Las Vegas. Whoa, Las Vegas, Nevada. And me and Dr. Silvana, we will talk a round table about biostimulants. Isn't it, Doc? We
Yes,
wait. We wait for all of you on this fantastic meeting. And yes, my friend, I want to let's say thank you so very much for being here with us. with Madonna because, well, I'm so old. And, well, no, no, something is
No.
strange. No, 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 Madonna. I'm so sorry. I'm so sorry, Madonna. Yeah, next time. Next time. Yes, Dr. Zulfi,
Thank
thank you so
you.
much for being here. Mrs. John
Thank you.
Ingold, DJ King, Sarawaya, Laus Schmidt, all of you passed by here. It's a pleasure for me for talking to my dear friend with brand new, interesting things. Dr. Anna Laskovska, wonderful to have you here. Dr. Laskowska, she works in Poland. I think it's Krakow, isn't it, Dr. Laskowska? And she's met her in Dubai for a course. She's a fantastic aesthetic doctor too. And thank you, Dr. Rafaela Corvallia, Dr. Zolfi Minas. It's a pleasure for me. Mr. K. Danke is maybe from German Switzerland.
Yes,
And yes, it's a
exactly.
pleasure for me, dear Silvana. You are fantastic,
Thank you,
friend,
thank you,
fantastic
thank you,
doctor.
dear.
Thank you so
Thank you.
much.
As always, you illuminate the audience and the colleagues.
Oh
It
no,
was an honor. No, no, no,
you
no.
illuminate Latin America.
Thank you very, very much. Thank you
See
very
you
much.
soon. Let's talk again
See you
about
soon.
biostimulants for
In the
body and
yes,
hands.
it's going to be very, very interesting. Yes.
Good. Thank you so much. Have a great
You are
Sunday.
welcome. Bye bye.
Bye.
Bye bye. Bye bye, everyone.